In Coligo, our stats program, we document how long we do the walking for in terms of minutes. On the program log, we enter how far they walk. And for myself, let's say, for example, we walk a resident for 5 minutes. We enter 5 minutes in Coligo. On the program log, we're going to be entering how far they walk. So here's where it's important to realize why we're asking you to enter the distance. If in that 5 minutes the resident walked 5 feet on the first of the month, and after 5 minutes of walking on the last day of the month, they're now walking 100 feet, you can really see the progression from 5 to 15 and all the way up to 100. It lets you know how they're doing in terms of improvement. If we would only put a check mark, we'd have no idea how they're improving. If we would be recording how many minutes they're walking for, we would just be putting 5 because that's how long we walk them for, right? So important to indicate if you're measuring the distance in feet or meters, and then to indicate that there. What I have suggested in homes is to take, the label makers, and most homes are in agreement with this. So you would make a series of labels, 0FT for feet or 0M for meters, and then 20 FT or 20 M, 40, 60, 80, 100 for however many feet or meters you need it. And then just to stick those labels either at the very top of the door jambs at 20, 40, 60, and 80 feet or meters, or some homes preferred putting them at the handle of the doorknobs. Some preferred putting them just on top of the baseboards at the bottom. But it's a fast way for you to be able to eyeball and see how far the resident's walking instead of having to count tiles or count steps like I was doing for a long time. You don't always have to start at 0 feet either. If you start a resident at the 20 feet label and they walk to 60 feet, you've walked them for 40. So it can be used in any sort of way. It just makes it easier to have an objective measure of how far the resident is walking. So that would be an example of what you would do for walking. Let's say the resident didn't want to walk that day. All of the codes for refusal are at the bottom of the program log. So for example, if you were advised not to ask the resident by the nursing staff, you would write ANA in that little square there. Instead of writing how far they walked, you would write ANA if somebody asked you not to walk them. There's also conflict in schedule, CS. If, for example, the doctor was in seeing the resident and you couldn't get back to see them, or they had another appointment with somebody else. If they're deceased, you would put a D. You would only put that once, obviously. Did not ask, DNA. That might be, maybe you go into the room and there are family members there and the resident's crying and it's very emotional. You may decide yourself not to ask them to participate in treatment, or maybe you didn't have time to get to them that day and you're supposed to see them every day, but you didn't have time for whatever reason. Maybe it's a short day for you, or it's a holiday or something. You would write DNA. G for done in group. So in some cases the physiotherapist may indicate on the treatment plan standing exercise class, and that's the only thing the resident has. Then they might also indicate under standing balance exercises, standing hip flexion right left sides times 10 reps, standing hip abduction times 10, standing mini squats, hold balance 1 foot 2 times 15 seconds right left sides, for example. And then I would write only to be done one-on-one if not already done in group. So you would have to put, for example, standing group exercises as one of the treatment programs, and then you would also put the individual ones that the physio asked you to do if they're not done in group. Standing hip flex right left times 10 reps. Standing hip abd, ABD, right left times 10 reps. Standing mini squats times 10 reps. Standing tiptoe right left times 10 reps. Hold balance 1 foot right left 2 times 15 seconds, for example. I think those are the ones I mentioned. You would write that down very specifically so we know if it's a number of reps that we're doing or a number of minutes. If it's right side, left side, both sides, if it's in standing, if it's in sitting, you put it very specifically. Now, if the resident went to their group that day, their standing group, you would write, standing group exercises, and then in brackets, number min for minutes, and you would write 30 to indicate that they went for 30 minutes. But now you don't have to see them one-on-one for those standing balance exercises because they did them in your standing group. So you would write G and put a line through the rest of them and an arrow to the bottom one of the ones that they did in group, so you don't have to see them one-on-one for. There's hospitalized, you would put H. If they're in isolation and you can't see them for that reason, you would write I. If they're not available, NA, so that could be perhaps they're busy in bingo or they're doing some other activity or something like that. Not found, NF. That can happen sometimes, that you're searching for a resident, you just can't find them anywhere and you can't find anyone to tell you where they are, or the nursing staff you find don't know where they are. That does happen. NH for no help would be, for example, if you've got sit to stand times 10 reps, assist times 2, or walking program, gait train, A times 2 for assist times 2, number of feet, but you don't have that second person to help you do the walking, you would enter NH for no help. NT for not today. If the resident says, you know what, I don't want to do it today, then you would just write NT, and that's like refusing, right? If the resident's out visiting a family member, out for an appointment, you would write O. If the provider is absent, so perhaps, what could this be an example of? If the resident is seen by two different PTAs, maybe one PTA does the group and the other PTA does the individual treatment, then if the individual treatment's not done because that PTA was absent and the PTA that only does group for them didn't do the individual treatment, you would write PA for provider absent. PR, pain related. If you come to see a resident to do their treatment and the reason they're not doing the treatment is because they have pain related to the reason of the treatment, so let's say somebody doesn't want to walk because their back is sore or their legs are sore, you would write PR. If they don't want to walk because they have too much nausea or pain related to their chemo treatments or something that's not orthopedic, then you would write PU, not PU, but PU for pain unrelated. And that's a judgment call. PV, if they're on palliative care, so you can't see them because they're deemed palliative right now. S for sick, and please be careful that your S doesn't look like a 5. Sometimes I see 5s and S's and they look very much alike, so it's hard to tell. Too aggressive, TA. Perhaps that resident is too aggressive today with their behavior and you can't do the exercises with them. Too confused. There are certain treatments that it's hard to do if the resident doesn't understand. So some of the balance training that we do in standing or sitting, if they have a very bad day for their cognition and they're really just too confused that day, you may have to enter TC as the reason that you didn't do it. Too tired could be either the resident says, I'm too tired, or it could be that the resident is really, really sleepy for some reason and you can't wake them up enough to do their treatment. Then you would enter TT for too tired. And the last reason is weather related, so W. We found that sometimes on very, very hot days in the summer, residents just didn't want to do exercises for no other reason than it was too hot. So we created that reason. Whatever reason you enter on the program log is the same reason that you're going to enter in Coligo when you do your stats. And we do keep track of the reasons why residents are not participating in treatments. In nursing homes, it's also very important to document because if they're on RI that week, then it's actually documented on their RI report. Maybe they didn't get all of their days and minutes that week because they refused. It's actually part of the report. So it's very important to document the reasons why people are not doing physio if it's in their treatment plan. At the bottom here, you're going to type, because this is a computerized form, right? You're going to type the PTA's name and put a slash, and then leave spaces for the PTA to sign their initials on the original form once it's printed. If you have more than one PTA in your home, you just type the one name, put a slash, leave some spaces, type the next name, put a slash, leave some spaces. You can fit up to 3 or 4 names on here. And then the PT's name, same thing, type their name, slash, and leave the space for the PT to sign. If somebody's having TENS for a treatment, for example, you would write TENS left shoulder times 15 min. If they're having wax hands, or right hand only or left hand only, times 15 min. And then when they have that treatment, you're actually documenting how many minutes they had the treatment for. So once you've actually documented all of the numbers, here at the just underneath that bolded thickened line, it has a check mark with did well or an asterisk for C notes. If the treatment that you've documented on the first there, everything was fine, all you need to do is put a check mark and then sign your initials on the PSP initials line. If for some reason part of that treatment didn't go so well, or there's something that you feel needs to be documented, instead of putting the check mark for did well, you would put an asterisk in that little box, and the asterisk means C notes. The notes that we're referring to are the physiotherapy progress notes, and this is what it looks like. It's basically just a sheet of paper on both sides with a bunch of lines and room on the left side for the date. Important to put the resident's name and date of birth on the top on both sides. And when you start to have when you have a second progress note sheet, I usually number them 1, and then the second one I put 2, or you can put 1 and 2 on the back side, whatever you decide, as long as they're numbered to help keep things in order. So if you put an asterisk here for something that didn't go well in the treatment, you would then come and write your full note here. So I've been using January 1st as the example. So here you would write January 1st or Jan 1 and the year. Please always put the year as well. And then you would do your full SOAP note. The SOAP note is SOAP, subjective, which is the resident's complaints, objective, which is what the findings are that you're writing about, analysis, which is what you're going to do or what you think about it, and the plan. So for example, if you're a PTA writing this note, you would write S, resident complaining of pain with pulley exercises, for example. O, pulleys not done due to pain. A, pain. P, please reevaluate resident for exercises, for example. SOAP notes are very often written by the PTs. For the PTAs, it may be difficult to fill all 4 of those criteria, so you could also just write a note that says, resident complaining of pain with pulley exercises, did not do pulleys today, please reassess. PT to reassess, something like that. Okay? So there's a documented note that something went wrong with the treatment. Now, once you've written that note here, how do you let the PT know? Because we don't always see the PTs every day and we can't always tell them verbally. And you know what? Leaving little sticky notes is not the best thing, because that little sticky note could get lost. It could get stuck under another sheet of paper, and now the physio is not alerted to the fact that you wrote a note about somebody having pain and asking for a reassessment. So we created, this is called a progress note, we created the progress note checklist, and this is what it looks like. Basically, when you put an asterisk on the program log because something in the treatment went wrong and you have to write a note about it, you alert the physio to the presence of the note by writing on this checklist.